Hello, I'm Dr. Jane, a urologist, and today I want to have a serious and straightforward conversation with you. If you're a man over 60 and you've noticed that your moments of climax feel different, where you experience the sensation of pleasure but without the presence of seminal fluid, this message is essential. Maybe it happened once and left you worried, or perhaps it's a recurring issue you've kept quiet about due to shame or fear. I want you to know that I understand your concern. What's happening in your body isn't a sign that your masculinity is at risk, but rather an important message that needs to be decoded. Stay with me, because in the next few minutes, we'll explore the causes, warning signs, and, most importantly, the solutions modern medicine offers to restore your peace of mind and well-being. Before we dive into the absence of seminal fluid, it's helpful to briefly review how the process works under normal conditions. Think of your body as a perfectly coordinated system. The testicles produce sperm, the seminal vesicles contribute most of the nourishing fluid, and the prostate adds a protective fluid. This mixture is prepared in the urethra. When climax occurs, specific muscles contract rhythmically to propel the seminal fluid outward. It's a quick event, the result of delicate synchronization between nerves, glands, and muscles. It's important to note that climax and ejaculation, while they happen together, are distinct processes. Climax is the neurological sensation of intense pleasure, while ejaculation is the physical act of expelling fluid. Most men experience them as one event, but they are separate mechanisms. Our focus today is on what it means when the sensation of pleasure occurs, but the fluid doesn't appear. This condition is known as dry ejaculation. A man reaches climax, feels the characteristic pleasure, but notices little to no semen is released. The absence of this physical component, which has always been considered an integral part of the experience, causes confusion and distress. Many men describe this to me in the office as an empty orgasm. This perception fuels worry and reluctance to talk about it. It's vital to understand that your ability to feel pleasure, governed by the brain and nerves, can remain intact. The change happens in the mechanical part of the process. This doesn't mean you've failed or lost your virility. It simply means that part of your body's function has changed, and this change has specific causes we can identify. One of the most common causes of this condition is retrograde ejaculation. Picture a small valve at the bladder's exit. During climax, this valve should close tightly to ensure semen is directed forward and out. However, if this valve doesn't close properly, the fluid takes the path of least resistance and flows backward into the bladder. The man feels the pleasure of orgasm normally, but since the semen doesn't exit, it feels like a dry climax. A common clue to identify this is noticing cloudier urine after intimacy as the semen has mixed with it. This can happen for several reasons. Surgeries on the prostate or bladder, such as those for benign prostate enlargement, can affect the nerves controlling this valve. Certain medications, used to treat high blood pressure or some mental health conditions, can also relax this muscle, causing the same effect. Additionally, neurological conditions like long-standing diabetes or spinal cord injuries can interfere with the nerve signals coordinating this closure. I recall a patient who, after a successful prostate surgery, was deeply distressed by this change. When he understood it was a mechanical alteration and that his potency and desire weren't affected, he felt immense relief. Diagnosis is simple, usually confirmed with a urine analysis right after climax. While it may impact natural fertility, your intimate life can remain full and satisfying. Another relevant but less known cause is obstruction of the ducts through which semen passes. The seminal vesicles, located behind the bladder, produce most of the semen's volume. If the ducts from these vesicles are blocked, the the semen volume can drastically decrease or disappear entirely, even if production is normal. Think of it like a blocked road. Traffic wants to pass but can't. Causes of these blockages can include past infections like untreated prostatitis that left scars. Small stones, similar to kidney stones, can also form and obstruct the passage. In some cases, cysts or other anatomical changes may be the cause. Symptoms can be subtle. Some men report pelvic discomfort during climax or notice that their semen has become thicker and less abundant over time. Diagnosis often requires imaging tests, like a transrectal ultrasound, which allows the doctor to visualize the seminal vesicles and ducts. The good news is that many of these obstructions can be treated either with medications to address an infection or minimally invasive procedures to clear the ducts, restoring normal flow. The third major area to consider is hormonal factors, particularly testosterone. This hormone is the main driver of male reproductive function. It not only regulates desire and sperm production, but is also crucial for the proper functioning of the prostate and seminal vesicles. When testosterone levels drop significantly, the entire system can be affected. Initially, a man may notice only a reduction in semen volume. Over time, other signs may appear: decreased libido, less firm erections, and a less intense orgasm sensation. On a broader level, fatigue, loss of muscle mass, and mood changes are also common. It's a mistake to chalk this up solely to aging. Often, it's a medical condition called hypogonadism, a hormonal deficiency that can and should be treated. Diagnosis is made through blood tests to measure hormone levels. If a deficiency is confirmed, hormone replacement therapy can restore not only semen production, but also energy, desire, and overall quality of life. So far, we've discussed causes that for the most part have solutions or management options. However, as a doctor, it's my responsibility to warn you that dry ejaculation can also be a red flag for more serious conditions. That's why paying attention to other symptoms is crucial. Certain types of urological cancers can cause obstruction of the ejaculatory ducts. Prostate cancer, for example, as it grows, can block the semen's passage. Bladder cancer, if located near the exit, can also interfere with the process. In these cases, the absence of ejaculation may be accompanied by other signs, like blood in the urine or semen or pelvic pain. Progressive neurological diseases are another important cause. Conditions like multiple sclerosis, Parkinson's, or nerve damage from poorly controlled diabetes can disrupt communication between the brain and reproductive system, leading to this and other dysfunctions. So it's critical to know when to seek medical help immediately. If dry ejaculation appears suddenly and without explanation, or if it's accompanied by pain, blood, fever, or loss of sensation in the genital area, don't wait. These are signs that something more serious may be happening and an urgent medical evaluation is necessary. Beyond the physical aspect, we can't ignore the profound emotional impact this condition can have. Many men associate ejaculation with their virility and performance. When it disappears, feelings of inadequacy, anxiety, and frustration can arise. It's common for men in this situation to start avoiding intimacy out of fear of being judged or feeling incomplete. This emotional burden is real and can negatively affect self-esteem and relationships. The most important step to breaking this cycle is information and communication. Understanding that this is a physiological change, not a personal failure, lifts a huge weight. Your ability to feel pleasure, have erections, and enjoy intimacy doesn't depend solely on the presence of fluid. Your intimate life can and should remain a source of joy and connection. Talking openly with your partner and seeking professional help are steps that restore control, boosting confidence and quality of life. To wrap up, I want to leave you with some practical advice. First and foremost, don't ignore changes in your body. A sudden onset of dry ejaculation warrants a visit to a urologist. Second, keep chronic conditions like diabetes and hypertension under control, as they directly impact vascular and nerve health. Third, adopt a healthy lifestyle. Regular exercise, a balanced diet, and quality sleep are pillars of overall health and consequently intimate function. Fourth, break the silence. Talking about what you're feeling, whether with your partner or a doctor, is liberating and paves the way for solutions. Finally, follow medical guidance, whether through treatment, a medication change, or a simple lifestyle adjustment. Professional support is your best tool. In summary, the absence of ejaculation isn't the end of your intimate life or a testament to lost masculinity. It's a signal from your body that deserves to be heard and investigated. Understanding the cause, whether mechanical, obstructive, hormonal, or neurological, is the first step to finding peace of mind. I've seen countless men regain their confidence and joy in living after receiving a clear diagnosis and action plan. Your vitality isn't measured in milliliters of fluid, but in your health, well-being, and ability to live fully. Don't let doubt or shame stop you from seeking answers. Acting in time can transform your experience, restoring the security and connection you deserve. If you found value in this message, please share it with a friend, father, or brother. This information can make a big difference. Leave a like to help this message reach more men who need to hear it, and subscribe to the channel, turning on notifications so you don't miss our upcoming content on men's health. Remember, prostate health isn't just about living longer, it's about living well. Stay informed, proactive, and above all, healthy. I'm Dr. Jane, and remember, your best years can still be ahead of you.